government worth its salt prioritizes the health and wellness of its peoples above all else, and one major way this can be made possible is through a well thought out insurance scheme which makes Medicare and Medicaid accessible to the majority. Since the inception of the present administration under the leadership of Prince Dapo Abiodun, the Ogun State government has taken the health and well-being of the people with no kid gloves. It has implemented people-oriented policies and programs in the bid to boost the healthcare sector in the state. Some of the activities in this regard include the upgrading and increase in the fleet of vehicles for the ambulance and emergency services, distribution of 3.7 million insecticide mosquito nets, mass vaccination against COVID-19 for residents, and payment of the sum of 100 million naira grants as a commitment fund to help facilitate health insurance scheme, among many others. Only recently, the Ogun State Governor, Prince Dapo Abiodun, launched the Basic Healthcare Provision Fund program and the Ogun State Informal Sector Health Insurance Scheme. This was part of the state policy on affordable and accessible healthcare delivery for all the peoples of the state. Of immense significance was the fact that the event had a symbolic edge, namely that the scheme was inaugurated as a feat commemorating the 46th year of the creation of our dear state.
Today's event is yet another watershed event in the enviable history of our dear state. Let me first join all of us in celebrating our dear state as we are another year older. This state was created February 3rd, 1976 out of the old Western region. Today we are 46 years old, and we've chosen that day to launch our health insurance scheme. It is indeed another milestone in the successful and continued implementation of the Building Our Future Together agenda in Ogun State.
The setting was the June 12 Cultural Center, Kuto, in Abeokuta, the state's capital, where dignitaries and eminent personalities, including stakeholders of the health sector, both at the state and national levels, top government functionaries, captains of industries, politicians, artisans, marketsmen and women, students, trade unions, and others from all walks of life had gathered to launch the lofty ideal, in addition to celebrating the 46th anniversary of the state's creation.
No, you cannot give him paracetamol. That is what they call self-medication. And we will take him to the hospital. This should not happen in the hospital.
We don't have enough to take him to the hospital.
Are you not aware of Ogun State Health Insurance Scheme?
Ogun State Health Insurance Scheme?
Yes, Ogun State Health Insurance Scheme. This scheme is from Ogun State government under the leadership of our dear governor, Prince Dapo Abiodun, MFR.
At the event, Prince Abiodun affirmed that social welfare was a vital part of the Isheya mantra aimed at improving the well-being of the citizenry.
As an administration, we have a blueprint that defines our social contract with the good people of Ogun State with the acronym Ishaya, I for infrastructure, S for social welfare and welfare, E for education, Y for youth empowerment and job creation, and A for agriculture. To interest this gathering to know that the importance of social welfare, which is the second pillar of our mantra, is our commitment to the provision of the required infrastructure and measures towards ensuring the well-being, wellness, and welfare of our people at all times. In fact, as an important kernel of this contract, the provision of qualitative healthcare service delivery to the people is a mark of a local statement of intent. That is, only a healthy populace can enjoy the provision of infrastructure and tap into the available economic potentials of our dear state.
He said the scheme, christened Ilera Dero, was to serve as a cushion for both formal and informal sectors to access basic healthcare services.
Consequently, it is the sense of duty and fulfillment that I launched this basic healthcare provision fund and the commencement of the informal sector health insurance scheme that I am today christening Ilera Dero. Ilera Dero. And henceforth, when we say Ilera Dero, you respond, Ajoshi Bubuani. Ilera Dero.
Registering for the scheme, Governor Abiodun urged residents to seize the opportunity created by the state government so that they could partake of it.
The 12,000 per annum payment is payable in 1,000 naira per month, so it's not unnecessarily burdensome. And like KBAC had clarified, 1,000 naira per month is just about 35 naira per day. 35 naira per day. I mean, come on, everybody can afford that. And I also want to thank the Speaker for his suggestion that members of the House should take ownership. They should, pay on behalf of their constituents. I expect all my commissioners to do the same. Your commissioners representing your people and also our leaders, rather than just dashing out money to our people. Let us, just like Baba Kabisi has said, let us, pay towards their provision. And for the family scheme, which is meant to be 48,000 naira per annum, it translates to 4,000 naira per month. And I'm sure that, all of us can afford to pay 4,000 naira per month for a family scheme.
The Executive Secretary, National Health Insurance Scheme, Professor Nasir Sambo, observed with its satisfaction the fact that health delivery in the state mirrored the federal government's policy on affordable and accessible healthcare delivery for all Nigerians.
I'm very delighted to be part of this historic moment in the nation's efforts towards improving the quality of life of the good people and hospitable people of Ogun State. I especially thank His Excellency, the Executive Governor of Ogun State, Prince Dafo Abiodun MFR, for the privilege to witness the launch of the Basic Healthcare Provision Fund and implementation of informal sector health insurance scheme in the gateway states. This is in alignment with the objective of achieving universal health coverage, which is one of the top priorities on the global agenda, as well as integral part of sustainable development goals. In pursuit of this goal, the present administration of President Muhammadu Buhari GCFR is working assiduously to ensure that every Nigerian has access to affordable quality healthcare services.
The State Commissioner for Health, Dr. Tomi Koka, had earlier explained that the program was aimed at ensuring that residents in the state had access to affordable healthcare services.
The launch of the Basic Healthcare Provision Fund is to ensure the provision of qualitative, affordable healthcare service to Ogun State residents with major emphasis on the poor, the vulnerable in the society, such as pregnant women, children under 5, the elderly above the age of 65, and the disabled. This laudable program is to be implemented by the government through Ogun State Health Insurance Agency in partnership with the Ogun State Primary Health Development Agency. Through the support of this administration, Ogun State has fulfilled all conditions to qualify for this federal government initiative, hence the launch that we are holding today.
Also, Executive Secretary, Ogun State Health Insurance Scheme, Dr. Afolabi Dosumu, hinted that both programs were backed up by law for sustainability, making the health insurance scheme mandatory for all residents, irrespective of race, gender, religion, and socio-economic status.
Health insurance has come to stay. It's the way forward for our health system. I encourage every one of us that are here to please help us spread this good news. Because the issue of going to the chemist, going to the patent dealer, going to an hospital and dipping your hand in your pocket to pay. If you look at how much you spend every month and how much you spend every year, you know that this is a good deal. It's a win-win situation.
He further highlighted the options open to interested individuals and families.
We have the formal sector health insurance scheme. We have the formal sector health insurance scheme. And we have another scheme for the poorest of the poor among us. And I'm going to start with that. It is called the Basic Health Care Provision Fund, which is one of the schemes that we are launching today. The federal government has given us some money. The state government is supporting that money massively to make sure that we enroll those in our communities that cannot afford to pay. For those that are in the informal sector, you need to make a token payment of 12,000 naira for 1 year. And once you make that payment, it is the onus is on us to come and enroll you. We have our agents in all 20 local governments. For a family plan package, instead of paying 72,000, the state government is also subsidizing that and asking us to pay just 48,000 naira. With 48,000 naira, we can do better than that. With 48,000 naira, the family of a father, a mother, and 4 biological children will be given these 6 cards, and they are also entitled to free health for 1 year.
This is Ogun State. Let us continue to maintain our goodly nature by doing the right things at all times. Pay your taxes regularly. Dump your refuse in designated places. Live happily with your neighbors. Let us continue to make Ogun State great. Ìgbéga ìpínlẹ̀ Ògùn, àjọṣe gbogbo wa ni.
Corroborating the legality of the scheme, Speaker, Ogun State House of Assembly, Right Honourable Olakunle Taiwo Oluomo, urged everyone to take advantage of the program by subscribing to the scheme.
I want to advise the agency in charge to appoint ambassadors at every strata of our society as insurance scheme ambassadors. Among the transport children, the students, the youngers, the banners, the traditionals, so that the orientation, the information can go deep throughout the state. That is number 1. Number 2, permit me to advise or encourage political office holders, be it elected or appointed, to use this as a sort of environment. Even if it is one person per ward, it will be an example. If you pick one person and say, instead of you coming to me, I'm sick, you want to go to hospital, register one person per ward in your name, and then let's see how others will copy it across the state.
Also speaking, the chairman, Ogun State Council of Obas and Nakarigbo of Remoland, His Royal Majesty, Oba Dr. Babatunde Ajayi, assured that traditional rulers will educate their subjects on the scheme and its benefits.
We have listened to Atibobu Bogoti Mosolataro, Ubokokue Otiyewa, Tiwani, and Alailua, láti sọ yìí pé òótọ́ ní kò kìí ṣe irọ́. Kí gbogbo àwọn ọba all the allied ones will go back and sell the program. We're not selling the government, we're selling this beautiful, laudable program.
Other well-meaning citizens, from trade and market unions to students and faith-based representatives, added their voices to the acceptance and benefits of the scheme to them and their members.
The organized labor want to align with the government of Ogun State in pursuing a goal of universal health coverage by the year 2025. We only want to appeal to the Ogun State Health Insurance Agency, who is responsible for mobilizing financial support for this project, to please allow the beneficiary to have free access to both primary, secondary, and tertiary health facilities.
Say on behalf of the over 2.1 million Nigerian students in Ogun State that we are not surprised that this kind of scheme is taking place in Ogun State. When you have a type of governor that have broken records and that have broken the status quo in terms of governance, these are the things that we expect in the dispensation of government and governance business in this state. Your Excellency, some of your programs are not only laudable, they are timely and they are surprising, most especially with the type of politics that we play in Nigeria. You have put aside political affiliations, you have put aside personal interest, you have even put aside regional interest in dispensing your duty, and we say we thank you. Finally, regarding to this program, I would like to advise that the state government utilize the existing health centers in Ogun State as a point of registration in our campuses, so that the process of registration and being able to benefit from this program will not be too cumbersome.
This is an opportunity for me today to thank Your Excellency in the public. The League has mandated me the honor to find time to see and thank you, Your Excellency. Be sure that this scheme from tomorrow in the mosque, we are going to announce and tell people what it is. Secondly, in the first and second terms, Our Excellency, be sure that the Christians and Muslims of the state we are with you.
On behalf of the leadership and entire youth of the state, thank you most sincerely for this worthy initiative. Your Excellency, you are making landmark achievements in infrastructure, in education, and very many other sectors in the state. This health initiative, this health insurance initiative is one initiative that the youth of this state are very much proud of, and we know that it is not only that this kind of initiative will continue to make your government to be government of the people, but will be a landmark achievement, an initiative that will outlive your administration.
Financial institution pledged its support to the scheme.
From EcoBank, the Pan-African Bank, we really appreciate what you're doing, Mr. Governor, for the people of Ogun State. Health is wealth. And if the health issue is solved, majority of the problem we have in Nigeria is already solved. Thank you, Governor. Thank you. This is a big one.
The representative of Market Women Association of Nigeria suggested some procedures that will make the scheme accessible to market women across the state.
Health is wealth. It's a very good product in the health sector. Why? Because majority of our women will be the most beneficiary of this program. I'm paying 1,000 naira a month and getting medical attention free. It goes a long way. And it will be in all primary and general hospitals. Not that we get there, as you show them your card, they will give you prompt attention. Even it is only for first aid, is a very laudable one. Whereas it's not only for first aid. You can give birth to a child even two times in a year. The program covers you all. So I really appreciate the program and thank the government, most especially our amiable and silent achiever, Prince Dapo Abiodun Emafa. We are going to do it like a kickstart. When we want to do something, we do fire brigade approach. All market women must key into the program. As we have said, they should put a center in the market where the market women will be paying their 1,000 naira. They cannot go to website so. But if there is a center in the market, they will all key to the program because we will let them know the importance and the benefits they will gain in the program.
Our crew caught up with potential beneficiaries of the scheme in both the formal and informal sectors.
The program is okay, and for the benefit of those that did not have much. So, and my advice to fellow women is to join the program in order to be a beneficiary. And also, I want to use this medium to appreciate our governor, Prince Dapo Abiodun, for the wonderful job he has been doing so far. And I pray that the Lord will continue to strengthen him. He has started well and he will end well in Jesus' name.
What I can say about this is good and can appreciate the governor.
Indeed, the state government continues to work hard at ensuring that the citizens are adequately captured in the delivery of effective healthcare services. The ball is now in our court as a people to avail ourselves of the numerous advantages placed on our table in order to get the best for ourselves and our families. Please embrace it. Ìgbéga ìpínlẹ̀ Ògùn, àjọṣe wa ni.